One.
Welcome to Forensically Speaking. This is a course that is brought to you by the International Association of Trauma Professionals, and my name is Harry Morgan. And I'm very, very excited about this course. I hope you are also. I think you will be as you take the course with me. Let's get an overview before we actually get into the course. And in the overview, we're going to be looking at what the course does not do. And that is that we're not going to be covering child custody, personal injury, malingering, competency, any of these other assessments. Actually, this course is the foundation course for these other evaluations or assessments. So we're going to then look, well, what do we do? Well, we're going to understand what the function is of a forensic mental health assessment. What is its purpose? What is the evaluator? What is the criteria? What are the qualifications? What are the sources that are used for a forensic mental health assessment, not necessarily used in a clinical assessment? And then we're going to understand what is effective mental health writing for the court. What is a clinical interview and testing, and how does that apply when we're looking at the court? And what are the elements, the parts of a forensic mental health assessment? We're also going to learn what are the legal and the ethical considerations in preparing a forensic mental health assessment. This is really important. The process of collecting the data, and then we're going to be looking at the process of writing a professional, culturally competent forensic mental health assessment. Finally, your assignment. Your assignment is going to be that you will have to write either of a client that you have, of course, removing all recognition of that client, or a fictitious client. You're to write a 10-page assessment that you would have used for the court. All right, that is the overload. Now we're looking at the modules themselves. There's 6 of them. The first module is going to be laying the foundation. Think of this as building a building. As you're writing an assessment, you're going to first lay the foundation. You're having to look also at you, the general contractor. You're the assessor. You're the one who is putting this all together. The blueprint, what is the overview before you actually get to writing it? What's it going to look like? What's the skeleton looking like? And what are the tools, the equipment, the building materials that you're using to create your forensic mental health assessment? And then, like all homes, a model home is built and you're having a walkthrough. We're going to walk through what a forensic mental health assessment actually is. Now, the explanations of how the course works. First of all, the course is divided into 6 modules. They're going to be approximately 10 to 30 minutes. We try to make them quick and short simply because we know that you're busy. And a 10-minute module you're able to do. When you have a 30-minute or more, it makes it more difficult. Each module may have more than one instructional video. Most of them won't, but a couple may. And then there is online discussion that will follow, and you're to respond to each one. There will be a question. You're to respond. I will respond back to you. Then there is a test, a quiz, and it's 10 multiple choice questions that will follow each module. And then there will be a writing project, which I mentioned to you earlier, that 10-page assessment that you would be using for a court, and it would be either of an actual patient or else that you would be writing fictitiously. All right, so that is the course. That's how it's going to look, and that's where we're going. I look forward to seeing you now at the first module. Have a great day.